Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello Sports Medicine Report. Today I'm going to speak about low back pain and bike riding. Low back pain is common in many sports, but it is very common in bike riding. Throughout this video, you will hear me say the terms bike riding, cycling, biking, and I am speaking about just riding a bike. I'm going to use those terms interchangeably. Approximately 23 million cyclists develop at least one overuse injury in their lifetime in the United States alone. Of these overuse injuries, low back pain is the most prevalent. 58% of professional cyclists reported low back pain, and up to 22% of cyclists who reported low back pain lost time from activity. During cycling, various positions are used to achieve proper aerodynamics to increase speed and efficiency, including lumbar spine flexion. A flexed spinal position commonly adapted by cyclists changes spinal loading. Sustained or repeated lumbar flexion is associated with low back pain. Several structure mechanics are hypothesized for the pathomechanics of a low back pain in cyclists. These include mechanical creep, which is a deformation or strain of the ligaments that occur with constant loading, disc ischemia, muscle fatigue, and overactivation of the back extensor muscles. Another mechanism is the flexion relaxation phenomenon, in which deactivation of the erector spinae or multifide muscles with a flexed spine causes vertebral body loading to shift to passive spinal structures, thus increases risk to ligaments and the intervertebral discs. Cyclists with low back pain demonstrated asymmetrical co-contraction of the multifide muscles, decreased thickness of the transverse abdominis and lumbar multifidi, and decreased back extensor endurance when compared with cyclists without low back pain. Now, this is very worth repeating. Cyclists with low back pain demonstrated asymmetrical co-contraction of the multifidi muscles, decreased thickness of the transverse abdominis and the lumbar multifidi muscles, and decreased back extensor endurance when compared with cyclists without low back pain. Now, I repeated that because it's very important. So what this is saying is that the multifidi muscles, which are the deep muscles in the spine, that when contracted bilaterally, they help to extend the spine. They keep the spine in a stable position. When these muscles are strong, because again, they are the deeper muscles in the spine, when they are strong, it allows the more superficial muscles, the paraspinal muscles, to function the way that they should. When they are weak, the paraspinal muscles have to work harder to help to stabilize the spine. So this is showing us that there is weakness in the multifidi muscles of cyclists who are suffering from low back pain. It also states that there is decreased thickness of the lumbar multifidi muscles and the transverse abdominis muscles. The transverse abdominis is the deepest core muscle. It wraps around the spine, acting as an anatomical weight belt. So it helps to support the structures. So therefore, if that area is weak, there is not enough stabilization in the spine. So the deep core is not functioning properly, and the deep spinal muscles are not functioning properly. And then also the back extensor muscles are lacking endurance. So this is telling us some very important things, that cyclists with low back pain have weakness in their deeper core, and that they lack endurance in the back extensor muscles. Several key factors exist in the prevention of low back pain while cycling. Think about the bike fit. Have your bike fit by a professional bike mechanic. This will help to get you in a proper position. You may need to adjust the saddle. You may need the handlebars raised up a little bit, because if the handlebars are low, then you are leaning farther forward. So have a professional bike mechanic fit your bike properly for you. Also, you want to strengthen the core muscles. You want to strengthen the transverse abdominis muscles. Again, this is the deepest core muscle. It wraps around the spine and acts as an anatomical weight belt, providing support to the spine. Exercises that strengthen the transverse abdominis include the abdominal drawing in maneuver, abdominal hollowing, and also abdominal bracing. And then when we speak about the lumbar multifide muscles, those are the deep muscles in the spine. We want to strengthen those muscles so that the paraspinal muscles, which are more superficial, can do their job and not have an increased demand placed on them. Because if the multifidi are weak, then there's an increased demand on the lumbar paraspinal muscles, and that can lead to fatigue and pain. You can strengthen the lumbar multifidi muscles on the football. You can perform football lumbar extension. Also, you want to perform isometric exercises for the lumbar extensors, or you could perform high rep exercises for the back extensor muscles. This is going to help to build strength and endurance in the back extensor muscles. In review, several things that you want to do. First of all, get your bike fit for your size. Every individual is built a little bit differently, so make sure that you have the proper bike fit for you. Also, you want to strengthen the multifidi muscles and the transverse abdominis muscles. You can perform the abdominal drawing in maneuver, abdominal hollowing, abdominal bracing, and you could perform lumbar extension on the football to help to strengthen the lumbar multifidi muscles. Also, you can perform isometric and high repetition back extension exercises to help to build strength and endurance in the back extensor muscles. Thank you, everybody, for watching today's episode of Dr. Ozello Sports Medicine Report. Please remember, watching this video does not take the place of seeing a medical professional. If you have low back pain, please see a medical professional to get an evaluation, a diagnosis, and a treatment plan. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. You could go to my website, championshipchiropractic.com, where you can get additional information on the book, and you could also find my blog. My blog contains articles on sports medicine, chiropractic care, health, fitness, exercise, and nutrition. Thank you again for watching today's video. Please feel free to like this video. If you have suggestions, feedback, or questions, please leave them in the comments section below. Also, you could subscribe to my YouTube page, Dr. Donald A. Ozello, DC. Always remember to train hard, but train smart. Get adequate rest between training sessions. Utilize nutritional and supplementation strategies that work for you. Stay injury-free and accomplish your goals.